Welcome to Kaumudy Global. Cancer is one of the horrifying terms in our life. Why? Because we often don't realize when it devours our life. We have witnessed many people breathing their last even before the stage of diagnosis of cancer. Coming to one of the common type of cancer diagnosed in women is the cervical cancer. According to the Centers for Disease Control and Prevention, all women are at a risk for cervical cancer. It occurs most often in women over age 30. Despite being largely preventable, cervical cancer is the fourth most common cancer among women globally, according to the WHO. In 2018, an estimated 57,000 women were diagnosed with the disease, and it accounted for 311,000 deaths across the world. Long-lasting infection with certain types of human papillomavirus (HPV) is the main cause of cervical cancer. When cervical cancer is found early, it is highly treatable and associated with long survival and good quality of life. Coming to health sector of India, it is well flourishing and trying to discover best medicines for every disease. India's COVID vaccination drive even made its name to global level and even became a role model to other countries. And one such happy news on cervical cancer is getting much discussed. A vaccine for preventing cervical cancer is all set to help us. Union Minister of Science and Technology Dr. Jitendra Singh on Thursday announced the scientific completion of Cervavac, India's first indigenously developed quadrivalent human papillomavirus vaccine (QHPV) vaccine for the prevention of cervical cancer. India's first indigenously developed vaccine for the prevention of cervical cancer will be launched in a few months and made available to the people in an affordable price range of Rs 200 to 400. Union Minister of Science and Technology Jitendra Singh on Thursday attended an event held to announce the scientific completion of the said vaccine. The scientific completion implies that R&D activities pertaining to the vaccine are complete, and now the next step of making them available to the public would take place. Speaking at the event, he said, COVID has raised awareness about preventive health care, leading to the development of vaccines like the one against cervical cancer. The schemes like Ayushman Bharat have made us think about preventive health care, and we can now afford it. The Department of Biotechnology has taken a lead in the matter and are in collaborative mode, he said. Scientific efforts at times do not get the scale of recognition they deserve. So, this event is to celebrate that scientific completion. CEO of the Serum Institute of India, SII, Adar Poonawalla, who was also present, told reporters on the sidelines of the event. The cervical cancer vaccine will be affordable and would be available in the range of Rs 200 to 400. However, the final price is yet to be decided. Poonawalla said the vaccine will be possibly launched by the end of the year, that is in December. First, the vaccine would be made available through the government channel, and from next year onwards, some private partners would be involved in this process. He also said that a plan to make 200 million doses is in place, and first the vaccine would be given in India, and only after that it will be exported to other countries. Rajesh Gokhale, Department of Biotechnology Secretary, said over 2,000 volunteers participated across the country for this golden vaccine. Dr. N. Kalaishelvi, Director General CSIR, said this is the first stepping stone and research in the field, and it will further continue. According to the officials, the QHPV vaccine, Cervavac, has demonstrated robust antibody response that is nearly 1,000 times higher than the baseline against all targeted HPV types and in all dose and all age groups. Cervical cancer in India ranks as the second most frequent cancer among women between 15 and 44 years of age. The Drugs Controller General of India DCGI had in July granted market authorization to the Serum Institute to manufacture the vaccine against cervical cancer. I am Shreya signing off. If you liked the video, please subscribe our channel and hit the bell icon to get the latest updates.